and welcome to Medical Dialogues show. I am Dr. Nandita Mohan, and every year 31st of May is marked as World No Tobacco Day. This yearly celebration it informs the public on the dangers of using tobacco, the business practices of tobacco companies, what organizations are actually doing to fight the tobacco epidemic, and what people around the world can actually do to claim their right to health and healthy living, and also to protect the future generations. Now, to talk to us on this occasion, we have with us today Dr. Vikrant Mohanty, who's the professor and head of Department of Public Health Dentistry at Maulana Azad Institute of Dental Sciences in Delhi. So, welcome to Medical Dialogue, sir. It's really a privilege to be interviewing you here today on World No Tobacco Day.
Yeah, thank you, Dr. Anita. It is really to be a part of this whole live streaming of this on World No Tobacco Day.
Great. Sir, now that we're talking about the role of dentists in tobacco cessation, if you could just discuss the impact of tobacco use on oral health and how quitting can actually benefit dental health in a way.
Yeah, thank you, Nandita. I think that's the most important question that needs to be answered. See, tobacco is, before we jump into actually talking about oral health and its manifestations of tobacco use in itself is considered to be an addictive, is classified under the international classification ICD-11 as a nicotine addiction is classified as a disease per se, and it has certain complete clinical manifestations, and as a in case if people stop its habit, there are withdrawal symptoms, there are issues, and that is why tobacco is so addictive. So number one, we start off with tobacco being addictive and understanding that. Number two, what we do is we have to understand tobacco does not spare any part of our body. Okay, from the tip of our of the nails on the toe, tobacco affects each and every organ of your body. So specifically, because we are from the dental background and being a public health dentist, our focus primarily remains on the oral manifestations of tobacco use. So let us start off with something very basic. So every tobacco user would encounter, whether he's a smoker or he's a smokeless tobacco user, like using khani, gutka, pan masala, sweet supari, or anything for that matter, he will be actually exposed to some form or other other form of tobacco, and that has a lot of oral manifestations. So the first thing, it starts off with stains of teeth. So the teeth get stained, they change from being completely white, they become brownish, yellowish, and then they keep changing their color to become black also. So first, from staining of teeth, once it stains, then you have further plaque accumulation, and it results in more severe form of gingivitis, which is a basic gum disease, following which, when the gum diseases are not settled and patient continues to chew tobacco or smoke tobacco, then it starts affecting the actual foundation of the teeth, the periodontium, which is the supporting structure of the teeth per se. So that itself, we move gingivitis or gum disease to a severe form of gum diseases, which is called as periodontitis. And after which, if it continues, there is the support system of the whole tooth is lost, as a result of which the tooth falls much before the time that we are considering. So the tooth loss is another outcome of continuous tobacco use. The next thing that happens is, because of tobacco use, all the because if you talk about the smoke, it goes into the oral cavity, it heats up the whole, it is much more above the normal temperature. That itself brings a lot of changes in the oral cavity, number one. Number two, when you chew tobacco, all the juices that are coming out, they affect the mucosa or the gums as well as the surrounding structures which are there, and as a result of which, the mucosa starts becoming tighter and stiffer, and that results in difficulty in mouth opening, and severe forms of tobacco use results in something called as fibrosis, and as a result of which the mouth opening is reduced. Normally it is 3 fingers, but as the patient continues, this mouth opening can go down to 2 fingers and even 1 finger for that matter. So this is another part of the finding. And then you have the ulcers, the white patches, which are called leukoplakia, where they could be red also. So you have erythroplakia, you have leukoplakia, and then all this erythroplakia and all this again moves forward. These are OPMDs, oral pre-malignant disorders, a group of disorders which are manifestation of tobacco use, and then they move on to cancer ultimately. So what I have tried to do is, there is a spectrum itself in the oral cavity. You don't have to go to other parts of the body. It starts from just mild staining to mild gum disease to oral cancer. So that's the spectrum that tobacco use brings in.
Definitely, sir. That's a wonderful overview that you've given. And now, the stage wise progression of how a simple tobacco use can actually progress to and lead to the development of cancer. Now, if you can just explain to our viewers, how can dentists effectively incorporate tobacco cessation counseling into their routine dental visits? As in, how can dental professionals assess the tobacco use habits of their patients during their routine regular checkup?
So let me tell you two things here. The first, from a dental perspective, being a dentist and heading the National Resource Center for Oral Health and Tobacco Cessation, I would like to tell that to all my dental colleagues, that please understand that as a dentist, you play a very important role not only in the oral health but in the overall health and well-being of a individual. That's the first thing that we have to believe in. Number one. Number two, as a dental professional, you can actually identify tobacco use. As I told you, the different manifestations, and a dentist is completely trained to identify these things. So please be aware, and always, every patient, whether he's a tobacco user or not, doesn't matter. It is important to start with the proper history, where you ask the patient whether they use some form of tobacco or not. So that's like the stepping. That's like you start from there. Ask every patient on every visit about his or her tobacco use, and whichever age group they may be, preferably adults. There are children also who do, but beware about the kind of age group that you're targeting. But adults, so surely you should ask, and children should explore. So that's the first thing you should do. Second thing is, as a dentist, you can identify the clinical signs and symptoms of tobacco use automatically. Please remember that your treatment out, whatever treatment intervention you're giving, whether you're giving a restoration, whether you're doing an extraction, whether you're doing a prosthesis, whether you're doing an implant, you're doing any kind of procedure, tobacco actually affects the outcomes of all these procedures.
Okay.
If you talk about scaling, the patient is again prone for staining and gum diseases if he continues his habit. If you do a restoration, like a aesthetic restoration, like composites, remember that it will get stained if the patient, even for that matter, laminates and veneers and also crowns get stained and affected, with the gums get affected because of the tobacco use. So that way, and implants can also fail. Just imagine expensive treatments of like implants, dental implants can also fail because of use of tobacco in some form or the other. So this is the whole way how a dentist, number one, can contribute in asking. Second, explain the patient that all treatments will be affected if the patient continues to chew or smoke. And third, counselor, as a healthcare professional who is supposed to provide holistic healthcare, and you are supposed to understand that just not dental treatment, but whatever supporting information is required for the dental care has to be also be provided to the patient. So in this case, what we normally do is, dentists have a very good opportunity when the patient is sitting right across to them, either on the consultation table or on the dental chair. There, you should use this opportunity to make it a teachable moment, and this is something which we always try to gain the maximum, that you make it a teachable moment for the patient. The patient goes back that knowing that he can quit the habit, number one. Number two, even though it is difficult, he can overcome it with a structured format and support from a dental professional. And number three, there are medications which are there, which a dentist can prescribe and provide me, or as a result of which I can overcome this. So this way, I think I wanted to summarize the whole thing from basic. You take inputs while you inquire the basic case history and take the basic information. Second, during treatment, you can discuss and tell them how it affects the treatment, because that is why they have come to you. Third, as a dental care professional, you can counsel them, make it a teachable moment. Utilize all the follow-up sessions in reminding the patients about these aspects, and also checking whether in the follow-up sessions what were the withdrawal symptoms when they quit, what all happened, how did they manage it, did they find something difficult, and is there anything else that you can help in. That way you can go about it.
Very true, very true. Well explained, sir. Now, if you could just give us a key highlight on the strategies and techniques that actually the dentist can use. You just mentioned out the three aspects of it. What dentists can actually do to help patients quit smoking or even using the tobacco product.
So as I told you, see, the first thing is that the patient, when he walks into a dental clinic, his sole purpose is to get the dental care. So use that opportunity, make it a point that you are using dental treatment as an opportunity to counsel the patient, and that itself. And counseling means not preaching him about how tobacco will cause cancer, because many a times these tactics don't work very well. So it is important, because many of the patients, mainly literate patients who have a certain level of understanding, even if they don't, you have to package your information in such a manner which is specific to the patient. So always remember, keep information short, keep information specific, and keep it on the treatment outcomes as well as the treatment need of the patients. So that is something which dental professionals have to start off with. And during the inquiry, as in during the basic examination, they should surely take into consideration the tobacco use since when they have started and all those aspects, and then build these 2-3 aspects, like the history of tobacco, the various stressors that are there for tobacco, for example the number of working hours, the kind of peer group he works in, and understanding the whole environment of how tobacco use is. So once you understand the environment, once you understand his dental after dental examination, get an overview of his dental condition, and then understand his social demographic aspects, club all these three and make it into a package which will help the patient overcome this habit. So you can have follow-up visits, you can also send reminders to the patient in terms of text messages, WhatsApp, or maybe when he visits to you, you can just give him a small leaflet to read, and that way you can combine all this and also use a lot of video testimonials. So for example, there are certain video testimonials of patients who have quit. They can be a motivator for other patients to quit. So that can also be used to share and motivate other people. So this
Very
is a
true,
few
sir.
things about
The
it.
video testimonial aspect was very good. That is actually going to be a lot effective, as I feel. People tend to relate, and they can get more outcomes from those video testimonials. Definitely, that's a very good point. Now, sir, if you could just tell me how effective are nicotine replacement therapies and other pharmacological aids when it is recommended by dentists? How effective have these been?
See, I would say that nicotine replacement therapy is one of the most. It has been used for quite some time, and in India currently 2 milligram and 4 milligram of nicotine replacement of different companies are available. The first and foremost thing is there are two parties. Whenever there's a treatment, there are two parties. One is the doctor or the dentist in this case, and the healthcare professional and the patient. So first, the dentist should be aware of what are the various nicotine replacement therapies, because nicotine replacement therapies comes in different forms. So you have nicotine gums, you have nicotine patches, you have nicotine lozenges, you have now nicotine sprays also coming in. So there are 3-4 things that are available in the market. Okay, the second thing is you should know the right technique and the schedule of these drugs. Because these are currently mostly sold on the over the counter, but as a dentist know how to prescribe these drugs. So for understanding the prescription pattern, what you need to do is first you need to assess the level of addiction of the patient. So for understanding or assessing the level of the patient, there's certain standardized scales which are called as the nicotine dependence scales, mainly known as the most commonly used as the Fagerstrom scale. This Fagerstrom scale gives us a level of dependence that an individual, whether he's a smoker or a smokeless, what is his level of dependence, and it gives a quantifiable score to that. So out of 10 points, you get a score. So there is low dependence, medium dependence, and higher dependence. So when the patient is classified the type of dependence, then you need to plan whether you need to give a 2 milligram schedule or a 4 milligram and 2 milligram combination schedule. Higher the dependence, obviously you start with higher. And let us, we all should know that nicotine replacement therapy means you're replacing nicotine which was previously available through the tobacco products by a more titered, continuous, stable form of nicotine, which is being used in a prescribed manner, so that and scheduled in such a way that it will be tapered down and let out of your system. So it helps you overcome the initial withdrawal symptoms like craving, restlessness, short-tempered, and other aspects of withdrawal are covered up with this nicotine gums or nicotine patches. Nicotine patches are obviously better but expensive. The only thing is you don't have to worry about chewing it every now and then. And patch once put throughout the day, and before you sleep you need to remove it. When it comes to gums, it depends on the dependence. If you're higher on dependence, at least a 2 to 3 hours you have to consume one gum to maintain the nicotine levels in your body. So that helps you, control the kind of urge, the craving that you have. So this way, you need to understand that nicotine, replacement therapy can help you in overcoming this kind of withdrawal symptoms.
Well explained. And so, lastly, Dr. Vikrant, if you could just explain to us what are the barriers that dentists actually face in providing tobacco cessation counseling, and how do you think they can overcome?
See, first thing we have to believe that first, as dental professionals, we have to believe that this is a modality which is a very standard modality. Number one. Number two, you need to be trained for this. So training is available. There are organizations like NIMHANS and other organizations across the country which provide proper structured training, and we also, the National Resource Center for Oral Health and Tobacco Cessation, are providing training to dental professionals and dental colleges right now. Next thing is, once you get trained, once you understand and believe that this is a modality which can be integrated into your current dental practice, the third thing is you need to practice it on a regular basis and keep yourself updated. So the challenges mainly with dental professionals is that, yes, they do not see this as an intervention, or maybe also as you can't charge anything separately for all this kind of services sometimes, because it becomes counseling becomes a part of a treatment modality. So you can keep that in mind. What you can do is, anything that you're doing, prophylaxis, oral prophylaxis or scaling, you can integrate counseling to that session, and maybe for one session, and then look whether the patient is responsive, then you can continue to other sessions. So what you can do is, one, you believe; two, you get trained; third, you start practicing what you're preaching. So third thing is to integrate this counseling regularly. The main problem arises is, one, you can't charge; two, they don't feel it is yielding any result; and three, sometimes the patients are not receptive, or they don't want this kind of treatment intervention from a dental professional. So that becomes a little bit of challenge, but I think a motivated dental professional can bring about change and convince his patients not only for treatment but also for quitting the habit.
Great. So thank you so much, Dr. Vikrant, for all your insights on World No Tobacco Day and gaining all the matter that definitely is needed for cessation, and what programs and what dental professionals can do on a daily basis. So thank you so much for joining us.
I would just like to add one thing here, Dr. Nanta.
Yes.
Because see, this year's theme is to protect children, protect children from tobacco industry interference. Let us, we all know that as dental professionals, we address all age groups. We address almost all the age groups. That is from a child to an elderly. We address all the age groups that we're talking about. And it is the moral responsibility of a dental professional that they need to understand this, and they need to integrate it at every age and at every contact that they have with their patients. So it is important, as a responsible healthcare professional of the country, we need to contribute into this whole effort, where the impact of tobacco is not only about dental problems, but it is much more than the dental problems. It goes on to the family, it goes on to their work, it ultimately, they lose their productivity as well as the quality of life, and ultimately falling trapped to the death, as in the death is the ultimate outcome of such tobacco usage. And that is what we want to avoid and prevent the suffering and improve the quality of life as a healthcare professional.
Yes, very well said, Dr. Vikrant. Definitely, one has to take that into account as well. So, thank you so much for joining us today and giving us all your valuable insights.
Thank you so much, and best wishes of the World No Tobacco Day to everyone. And we stay quit, and we never, support people who really want to quit.
Very true, very true. So, thank you so much.
Thank you. Take care.
Okay.
Take care. Thank you.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.